Yeah, thank you very much. Yeah, from the very futuristic scenario that Dr. Kalpe showed us, we'll come back to the real-world experience. As you know, recently, we as vascular surgeons are called upon to see a group of patients who are very sick, and I would like to present this group of patients in front of you to at least get some answers, how we really deal with them. So I have no disclosures. And in 1990s, our group reported a small number of patients who developed lower extremity ischemic symptoms from a variety of causes like severe acute dehydration, hypovolemia, sudden cardiac decompensation, and we termed this as a low flow state induced limb ischemia. And at that time, highlighted the fact that this entity portended poor prognosis, and this was marker of limb loss or even death. Actually, we have to say, Frank Weith had described this scenario in one of his papers and called it a pseudo-embolic obstruction. My point is that in these 30 years, we really have not had much success in treating this group of patients. In the late 90s, significant strides were made in knowledge and technology about cardiovascular hemodynamics that we all know. An entirely new generation of drugs became available to treat cardiac dysfunction, calcium channel blockers, beta blockers, ACE inhibitors, ARBs, and drugs to correct rate and rhythm disturbances. This remarkable progress did indeed see a decreased incidence of low flow state conditions, and in fact made a lot of patients who presented to the hospital almost near death, and the cardiologists and cardiac surgeons were able to pull them out of this near-death scenarios. In addition to the pharmacologic assistance to the failing heart, mechanical circulatory assist devices were invented to further support and sustain these patients. The goal is to continue to maintain circulation and vital signs while providing rest to the heart. Pacemakers and defibrillators were the very first type of these mechanical circulatory assist devices. Now we have a range of these circulatory devices, starting from intra-aortic balloon pump, Impella, and these are amazing innovations where they essentially take the blood from the ventricle, pump it to the aorta, and then I have a pump that actually maintains the circulation when the heart is being given some rest. Similarly, we have tandem heart. We have ECMO, of course, you all know, is used for patients both with a combination of acute cardiac and respiratory failure. A cannulation takes the deoxygenated blood from a central vein or the right atrium, pumps it past the oxygenator, and then returns to oxygenated blood under the pressure to the arterial side of the circulation. This is now the most commonly used mechanical circulatory assist device in our ICUs. It can be used for days to weeks, and of course, both for cardiac and respiratory. And of course, we also have the LVAD, which is a left ventricular assist device that keeps the heart rest and continues the function of the heart as the patient is recovering or is being prepared for heart transplantation. Now, interestingly, it's funny that, now it has been proven that these circulatory mechanical assist devices actually can make the quality of life better and also longevity better. As you can see in this slide, the pharmacological, in the blue, see this is a 24-hour survival, 24-month survival, and the red line is that with the mechanical circulatory assist devices like LVAD, certainly keeps them going farther, and also more patients are living with this. And in fact, the quality of life also is improved, and it has been shown by cardiology and cardiac surgery literature. But what we have as a vascular surgeon, recently we have seen an increase in number of patients with low flow induced limb ischemia. This is seen selectively in high-risk cardiac patients who present with cardiovascular collapse and are resuscitated. Essentially, a large number of these patients actually have cardiac arrest. They're resuscitated by the cardiologists and cardiac surgeons, and now they're maintained on these devices. In addition to, of course, all these patients are universally on vasoactive drugs, like vasopressors and other things. A significant number of these patients are maintained on mechanical like IABP, ECMO, Impella, etc. And what happens to them, unfortunately, is that they all develop limb ischemia, both upper and lower extremity ischemia, and now we are called, and unfortunately, these patients are so sick, the vascular surgeons cannot do too much. This is a classic example. This is a patient being ready for a heart transplantation, but now has developed gangrene of the toes, because when he was very sick, he had virtually no blood pressure at all, and he was on vasoactive substances. And this is another patient, very similar. We are seeing all these patients, and low flow state induced limb ischemia, we call. And this is a classic, but this is just one of our recent patients. She's only in her 30s, came with a viral myocarditis, complete cardiogenic shock and cardiac arrest, maintained on Impella, ECMO, LVAD, etc., for nearly 4 weeks, and then she improves, believe it or not, goes on to complete recovery, but meanwhile, she has got this gangrene of the fingers. And believe it or not, both fingers and feet are gangrenous, and she has a palpable DP pulse. This shows that this is really a very peripheral phenomenon. Exactly. Unfortunately, she had, so all these devices are amazingly great in saving lives, but we are doing this at the cost of, limb loss in some of these patients. So my point is that there has been a significant surge of these mechanical circulatory support devices. In our hospital, actually, our trauma surgeons are putting them on for patients who come in with hypotension and shock. Pediatric surgeons are putting them for kids who come with severe problems. So we have seen a number of patients with upper and lower extremity ischemic events resulting in amputations. There has been no large reports in literature, either vascular or cardiology or CTS literature, about the extremity amputations in this group of critically ill patients. While these devices are life-saving, more attention needs to be focused on how to prevent these serious life-altering events. Thank you very much.